Welcome to CCHR. We're going to have a really interesting talk here today. My name is Pamela Seefeld. I'm a clinical pharmacist. I've been a pharmacist for 27 years. And in pharmacy school, I studied something called Pharmacognosy, which is plant science. I also trained extensively in Europe, in Germany, and also in England on homeopathic medications. So I teach this at St. Pete College, and I've also grant review for the National Institutes of Health in Washington D.C. on drug interactions and herbal interactions as well. So I have a varied background. I also have my own pharmacy that's right here in Clearwater called Botanical Resource, and what I do there is people come to me and they don't want to be on cholesterol medicine, psychiatric drugs, whatever it may be. Psychiatric medication is my specialty, but I do pretty much everything. Like, you don't want to be in your blood pressure medicine, you don't want to be in your cholesterol medicine, whatever may be going on. I see a lot of children, and I even do homeopathy for dogs and cats, which works really, really well. It's a lot cheaper than going to the veterinarian if your dog or cat is sick. So I see a lot of animals too. So I have to say, I really have a really interesting job, and I still work full-time as a pharmacist as well. So I do a lot of different things. I'm teaching, I'm doing a lot of things. But anyways, today we're going to talk a little bit about dangers of psychiatric drugs. We're going to talk about how they don't really work very well, okay? And we're going to talk about some things you can use in place of that. And then we're going to also highlight, talking about children and some of the problems that we're seeing with the medications that they're using, okay? So just to kind of go through an introduction a little bit about the brain. Your brain is about 4 pounds of fat, and it's sitting on top of your head, and that's what it's made of, okay? Your brain's actually made of docosahexaenoic acid, which is what's found in fish oil, okay? And folic acid myelinates the nerves. So if you look at the nerves themselves, like what are they made of? What are the building blocks of your brain? The outside of the nerve is made of folic acid, and the inside of the nerve is made with, basically fish oil. Fish oil contains EPA and DHA, and they kind of interconvert back and forth, but the interesting part is that they don't really find EPA in the brain. So, and why this is important is because you can do different types of omega-3s, different concentrations will affect the psyche differently, okay? So the easiest way to start looking at treating people is saying, okay, what can we do to repair the brain, okay? Because there's some people who have depression or anxiety or whatever they might have. We also want to do something to transition them off medicines if they're on medicines. And then secondly, a lot of times I use like a detox because this pulls things out of the body. Sometimes people have like heavy metals, pesticides, stuff like that. They do affect neurotransmission a lot. And don't forget, if somebody's had any kind of elective surgery, the anesthesia, the fentanyl, the Versed, the drugs that they use during these procedures, they stay in the fat-soluble tissue for years. So when somebody has, let's say, a knee replacement or something happens, and they've been under anesthesia, why do they feel so exhausted and tired? Well, it's not just because they had the surgery. The anesthesia keeps floating around in their body. You need to clean that out. So when I have people doing any kind of elective surgery, it's a hip replacement, knee replacement, whatever, I usually have them start this immediately in the hospital room because then they're back on their feet and feeling better. But you have to realize the body's dynamic and it changes. So the things you give it, kind of like you are what you eat, the things you give it in supplements change the way the brain's actually functioning. Okay, so that's kind of important. That's a little bit more like just the background of the brain. Okay, so your brain does change based on what you're eating. Okay, and there's a lot of orthomolecular psychiatrists that even treat people with protein because protein, amino acids make up the neurotransmitters. So these are some simple things that we can do, but I'm going to kind of go over to the drugs now. So just understand like how the brain works. I want to mention something else about the fish oil. When you have fish oil that's got a higher EPA concentration, okay, and you can look at the back of the box to determine what that is. And if you have questions, I do this for people. I have certain concentrations I use for certain things. EPA tends to be more mood elevating. DHA tends to be more calming. And I'll give you an example. Like say I see somebody that's got a child and they said, well, I read or my chiropractor told me to take fish oil for my son and he's hyperactive and they want to put him on drugs. Well, if they're using it high, welcome, come on in. Hello. Have a seat. Thank you. So if the person that's recommending that doesn't know the intricacies of the fish oils and how to use them, and I see this sometimes where the child might be having hyperactivity to some degree, kind of acting out in school. If you give somebody, hello, welcome, have a seat. If you give somebody fish oil that has high EPA concentration, they're going to be hyper. It's going to raise them up. So that I've seen, I can't tell you, on numerous occasions where whoever selected the fish oil picked the wrong product and exacerbated and accelerated the problem. So I have to just say, there's nuances to way. I've been doing this so long, like 25 years just in natural health, that I know what concentration I use for what. There are certain people that if you're using more DHA and it kind of calms them down, it'll make them depressed. So you got to be very careful with that. A good example of something you really don't want to use is DHA by itself. There's a product called Neuromins that's from algae, and that product there is DHA only, and then when you use that, I've seen people, and the minute I see them, I'm like, you're really depressed, aren't you? I'm like, oh my God, yeah. I'm like, don't take that. So there's a finesse to it, and I answer all my questions. There's no charge for my consultations. If you have a question about what you're taking, is it the right concentration for you, maybe a child or something else, just call me. I'll be glad to take care of it. I do this all day long, okay? So basically I was talking, the brain is made of the fish oil and it's made of the folic acid. So if you want to change your brain and have it function better, but you have to realize too, fish oil and folic acid, they cut your heart attack risk like 75%. So what are the things that we're like all at risk for? Heart disease and cancer. So I can't tell you like how many times I sit down with people and they got piles of vitamins and stuff that they bought, and they bought them here and there, the health food store, the doctor, whatever, and they're not protecting against either one of those problems. I don't know what. So I'm telling them, like, well, the two things you're probably at risk for, you have nothing here for that. So I really am kind of like, you got to hone in. You know, what are you risk for? What do you need? Just take that stuff. And if you want to take 1,000 other things after that, I'm fine with that. I mean, I take a lot of stuff myself, but I really think it's important to just address that we have certain risks, and we want to take care of those. Now let's go back to the mental health realm. So what are the things that we see that are a problem, okay? If you go to the doctor or the psychiatrist, what does he give people? He gives them antidepressants, okay? Why is there a problem with antidepressants, okay? If I give someone a serotonin reuptake inhibitor, okay, these drugs have a response rate of less than a third, okay? So we'll just talk about response rate. What does response rate mean? Yeah. I have a group of people, and out of 100 people, maybe 30% will respond, maybe, okay? So that's a really low response rate. In drugs, we call that response rate. It's a low response rate. So why is this a problem? Because, you know, somebody maybe is acutely sad, they have some issues going on, maybe their spouse died, something, and things happen, right? That's life, right? Things happen that you're not always going to be 100% happy. But there's a product called Omega Bright from Dr. Andrew Stoll, and it's a EPA to DHA ratio of fish oil that's 7-to-1. He has a patent on that, and that product actually was shown in clinical trials, double-blind, placebo-controlled trials, to be better than Zoloft in depression. So I use tons of that. It's not at that food patch or the health food store. You can't get it there, but it's not that expensive. It works very good, and I probably sell like 300 boxes a month of that, because people, even if they're not depressed, they want more energy. You know, maybe after they work all day, they don't have enough energy to go to the gym or whatever. It really perks you up. So I would say the majority of the people I haven't transitioned off drugs, though I use it for that. But a lot of people you just have great energy, and especially if you just have long days and you want to have more time for exercise and not be fatigued when you get home from work. I see a lot of people buying it for that. So those things here, so the response rate of that fish oil is really high. It's like 75%. So why would you use a drug when the response rate is a third, okay, and then you have all these side effects, all these drug interactions? It's dangerous when you can get the same effect or better with fish oil. Remember, I told you the fish oil protects against heart disease, right? It protects the brain. It's doing a lot of the things. It actually protects against arrhythmia. A lot of people, when they reach middle age and older, what do they end up with? Atrial fibrillation. Does anybody know what that is? Where your heart's like fluttering, and then they put them on a bunch of blood thinners and all these drugs. That's completely avoidable. If you take fish oil every day, it has antiarrhythmic properties in the heart, and the chances of going into AFib are pretty much gone. And I can't tell you that the population that I work when I'm at the hospital, you know, everybody over 65, they're all on all this stuff. They're taking all this stuff, and then they have to have drug monitoring, and they have to have side effects, and they can't eat this, and they can't. It's a total mess. So this could have all been avoided if they just would have taken some fish oil to begin with. Okay, so that's just the emphasis kind of on what you need to be taking. That take the right concentration for whatever your particular needs are. The same thing goes for kids. If you have a child that's having hyperactivity, you don't want to give them a high EPA concentration. I use a concentration of DHA to EPA of 4.5-to-1, which is pro-DHA. I take that myself. I like it. It's designed for children. It's a little capsule. It's strawberry flavored, and what it does is it has this calming, focusing effect. So if somebody comes to me and they're like, I'm stressed out. I mean, it's good too, even for adults, because it just kind of calms and focuses the brain. So if you have like a lot of stuff to do, multitasking, you're much more effective. So I like that. I take it every day. I use a lot of that. So usually, and I have some people taking both, right? So like say you get up in the morning and some people have sadness or they have no energy. They might take the mood elevating one in the morning and then take the calming one later in the afternoon so they sleep better. The Pro DHA, well, I'll tell you one thing, if you don't have good sleep, you really get into deep sleep quick. And that's the feedback I get from other people, but you sleep really well and you have very vivid dreams that you remember, and that's kind of nice. So you're really getting into that deep REM sleep, whereas a lot of people are not getting into those deep phases of sleep. Pro DHA, it's not expensive, it works really good. You'd be on fish oil anyways. If you have kids in the family, you have grandkids, so just bring a bottle to their house and they should be taking it too. So that's kind of, we're talking about the different concentrations. So response rate of the medicines is very poor. If you have a drug that has a less than 30% response rate, let's say it's for cardiology, let's say it's for some kind of heart problem. If I had a drug that was for the heart that was less than a 30% response rate, I don't even think they'd use it. I mean, why would they, really, the cardiologists, would they even use it? Seriously, they wouldn't. They'd be like, I'm not using this stuff, that's not going to work. So you need to put yourself in that mindset. Another drug class that they use a lot is when you have antipsychotics. Okay, so like they give these antipsychotics to kids to basically slow them down. Abilify is like one of the number one cost expenditures for the government because all these kids on Medicaid, they're all getting that crap. Okay, all of them. So, and it's very, very expensive, and they use it for a lot of older people too to kind of calm them down. You don't need to be using that. And the response rate, remember I was talking about how things respond? Well, response rate of antipsychotics is like 1 in 6 people. Okay, so that's even worse. So it doesn't really work. It doesn't respond for most people. Now, if somebody's acutely psychotic, and I have seen people that they really have been hospitalized a lot, the fish oil can help a lot. There was a doctor, he's no longer alive, but his son's carrying on that, Abram Hoffer, and he's very famous. He was up in Canada. I actually met him before he died a long time ago. And he's wrote some really interesting books, and he treated schizophrenia with vitamins and fish oil and niacin. And I actually met a patient of his, it had to be like 15 years ago, at some kind of a seminar that they were speaking about alternatives to mental health. There was a bunch of psychiatrists, a bunch of different people that kind of are in my profession. And he told me that, he had been a schizophrenic and that the vitamins cured him. And if he actually followed the diet that he gave him, and it's basically a very healthy diet, no smoking, no drinking, all these kind of things just kind of clean up the body. But he was very famous for that. His son's actually a doctor up in Canada now, and he actually continued his work and seeing patients and stuff. So it's not like this hocus pocus pie in the sky kind of stuff. And I want that really be said, because a lot of people that might be trying to do alternative, they don't really understand all the history behind it and where we've come from and where we're going to. Pharmacology is what I teach. So I mean, if you want to know where something works in the brain or the body, I know it. Okay, I know the receptors. I know exactly where it is. When you take the fish oil, you are actually refurbishing what's called these little tails, which are part of the cellular membrane. So it makes up the membrane. Whatever you give your body, it's going to put into the cells. It's going to form, our body, because basically what are we? We're water and carbon, right, with a bunch of electrolytes. We're the earth. No, we really are. We're just the earth. I mean, when we do blood work at people, and when we're in the hospital, and I read people's sodium and potassium and phosphorus, you're just a bunch of elements. At the end of the day, if they cremate you, what are you? You're just a bunch of ashes. Ashes and water. That's all you really are. So you have to think about it. You're organic. So if you're organic, what does that mean? Whatever you're consuming, taking, that's why it's important to drink water. It's important to eat a good diet. All those things you do really make a big difference. Yeah, once in a while you might want to have a bag of Cheetos or something. I get it, okay? But your daily routine needs to include lots of vegetables, not so much fruit because you can end up with diabetes, but lots of vegetables, lots of water, plenty of sleep. You guys know this, okay? But mental health starts with good health to begin with, and I'm not saying anything bad, but like people have little kids and they just feed them macaroni and cheese and chicken fingers. That's not going to help, okay? Doesn't mean you can't have it once in a while. I tell my families that have kids that they just want to eat pizza all the time. You take one day of the week where you just eat whatever you want, right? They get to choose whatever they want. Pizza, mac and cheese, chicken fingers, whatever, all this junk. The rest of the time they have to eat good. But then they know they get their cheat day. And I think, everybody has to have, a day where they feel like they can splurge a little bit. And that seems to work a lot better for the families. So that's important to realize that food does have things to, food can heal. Okay? It really can. And don't you feel better when you eat better? I know I do.
Yeah.
Okay. So the food's important, the supplements are really important. The fact we need to recognize that the drugs don't work, okay? Even the fact that the drugs are bad, just aside from that, response rate's very important. So if you're talking to people and you're trying to convince them not to use these medicines, what you need to do is, instead of like saying, this is bad and this is good, that's not the way I operate, right? You got to convince people, and you have to have a definitive argument, like, why is something not good? Well, first of all, it doesn't work. Secondly, you have all these drug interactions and it's dangerous. And thirdly, there's some really safe alternatives, fish oil and folic acid you'd be taking anyways. Why don't you use the concentrations that will specifically heal the body and change the way you feel? That's the way I look at it. Yes, you have a question?
Can you explain interaction again, please?
Yeah, so an interaction means when two things act together and you get an untoward reaction towards it, okay? So let me give you an example. So say I'm taking two medications. A good example is drug interactions, like St. John's wort. Okay, St. John's wort interacts with a lot of things, and the reason why is there's enzymes in your liver called the cytochrome P450, and the cytochrome P450 metabolizes, I'd say, about 90% of the medicines and the things you take. So if you take St. John's wort, it can induce the enzyme's activity. So why does that mean? So like if I'm taking a blood pressure medication or an anxiety medication and I'm taking an herbal product at the same time, that particular one, what happens is it's going to increase the metabolism and the drug's not going to work. So say the doctor puts me in a beta blocker for my blood pressure. This is where pharmacy is important, because the nuances of where things act in the body, where these enzymes are located, what they're doing to the drugs, what they're doing to the vitamins, that's like a whole science in itself. Trust me. I mean, it's I probably read 3 hours a day. It's a lot. Okay, so I can control one thing. I can tell you that if you're going to convince somebody not to put their kids on these medicines, if you're going to convince somebody not to take these medicines themselves, what you need to do is have a good argument. And the argument is the drugs don't work, they're dangerous, and there's other things you can use that are perfectly safe that you'd probably be taking anyways, but we're going to tailor this concentration based on your particular needs. And that's really what it's about. You know, we all have, you know, not an unlimited time every day. We're all busy. We all, you know, have things that we're trying to accomplish and goals we want to accomplish. We're only here a short time. So, you know, to spend your time zoned out on drugs, and, you know, I'll tell you, especially like the antidepressants and the anxiolytics, I can always tell when people are on that stuff. Their affect's flat. They're just not engaged in the daily conversation. I mean, I can spot it a mile away. It changes the way you respond to things. Life's going to be like you're happy one day, you're sad. That happens. If you're having too much of one or the other, then you need to address it and take the fish oil that corresponds to what you need. And that's really important. Yes?
Can you talk just a little bit more about the fact that drugs that have a poor response rate may still have adverse side effects?
Yeah, they go hand in hand. So any drugs you take are going to have some side effects. All of them, okay? And some more than others. And I see this a lot, actually, working in the hospital, because people come in and what they're really experiencing are side effects to their medicines. It has nothing to do with their disease state. And, you know, really, disease is a frame of mind. I mean, that's the way I look at it. I mean, granted, some people have some issues. I know that. Maybe your cholesterol's high or something. But a lot of people that are having these issues, it's not because, you know, the drugs aren't solving it. They're not doing anything, actually. They're making it worse for a lot of people. So I want to also mention something about the side effects, and I want to mention something about cholesterol. When people take cholesterol down too low, okay, I see this a lot. Like, say somebody had stents, or they were a heart patient, and the doctors put them on a statin, and they want their cholesterol really low, you know, because we don't want those arteries to reclog. The problem with cholesterol, if you get like down 160, 140, okay, you start keeping it down like they're doing, it affects your neurotransmission a lot. So I tell people that have really low cholesterol, I go, you're going to end up really depressed. And there is a higher risk of suicide with low cholesterol, okay? So someone's cholesterol, if it's been artificially reduced, or if their diet just has no cholesterol in it or no fat in it, and, you know, they're doing this no-fat diet and they're not having enough. Cholesterol is part of every cell membrane in the body, and especially the brain. So I just tell people, like, you know, you might want to keep your cholesterol low, but I do not want it ever to go below 160, 150, something like that, because 140 is really associated with problems. So say you have an elderly relative, and maybe they're having confusion, and they're not, you know, they're combative, and, you know, like this happens sometimes when people get really old and they want to drug them up. The first thing you got to look at is their cholesterol. You got to look at their medicines. A lot of these people, it's completely from all that. So, you know, I see that quite a bit, actually, because, you know, I've had people that are maybe taking care of an elderly relative at their house, or maybe they're independent still and they don't want to put them in a facility, and I get that. You know, I hope I'm like 100-year-old still sitting at my house. You know, I don't want to have to go to a facility unless it's necessary. But, you know, keeping the cholesterol at a normal level is a big part of it. It's going to affect your brain and it's going to affect your functioning. So I tell people you get the cholesterol too low and you're going to end up with issues, especially depression. So keep that in mind. If your cholesterol is being lowered artificially, you've got an elderly relative, your grandma, grandpa, or something like that, it's, you know, they're keeping this cholesterol. We got to keep it low. We got to keep it low. No, you don't. Okay. Yes.
Yeah, for people who've been on anti-cholesterol drugs long term, do they have any problems stopping them or getting off them?
Not really. Actually, I transition people off that stuff all the time.
But you transition. How do you transition?
Well, most of the time, first of all, we look to see what their baseline cholesterol is. And let's say they're on lovastatin, 20 milligrams at bedtime. I use a lot of Pantethine. I have like a medical grade Pantethine. That works really good. We try and bypass the liver. We don't want anything that's going to go through the liver. Like when people use red rice yeast, and I sell a lot of that, but when you use red rice yeast, it works like a statin and it can damage the liver too. So the best thing is Pantethine works good, polycosanol works good. I have a bunch of products that I use. They're not that expensive, and I just tell people, we're going to transition off, do it like for a month or so, regroup, and see, you know, how much it comes down. And if it's not coming down enough, I have to increase the dose or whatever, but you have nothing to lose. You got 30 days, see if it's any better. But that's what I typically do, because if the cholesterol is being lowered artificially, not only that too, you guys know that those drugs cause a lot of memory problems.
Yeah.
And they're associated with kidney failure. So you really want to try and not take this. Another drug class, and we're just talking about mental health too, but if somebody's taking a lot of those proton pump inhibitors, the stomach acid blockers, that's associated with a lot of adverse outcomes, including psychiatric outcomes that are not good. Okay, so if your stomach acid is bothering you, I have homeopathic stuff that works really good. I sell a lot of it. I mean, I would not be on those stomach acid blockers because you don't absorb any calcium, any magnesium, any iron. It's a good way to end up with brittle bones and also anemia. I see that all the time where someone's been on it for like a year or whatever because maybe they had, you know, a hernia or they had a lot of gastritis and dyspepsia. And right away, I'm like, yeah, it's making you anemic. If you can't absorb your iron, and I have to laugh because they got all these elderly women on calcium and D, and then they put them on a stomach acid blocker, and they're not absorbing any. Why bother? I said, don't waste your money. Just forget buying anything. Just forget it. Leave it in the cabinet. It's not being absorbed. Why bother? Don't take it. You know, it's one or the other. You know, it doesn't work that way. That's not the way life is, right? But at least knowledge is power. Right? Because if you know what's wrong, you can do something about it. It's the people that are kind of meandering around like, oh, what are we going to do about this drug? And well, it's just facts are facts. That's where I like objective versus subjective. Subjective is, you know, well, I'm not sure. You know, I think drugs are bad. We don't want to use them. Objective is, this is the response rate. This is the problem. This is how they don't work. And when you look at it in an objective versus a subjective, I think you're much more effective in convincing people to understand what needs to be done. And we're just really highlighting a few little things here. I mean, I do a lot more even than what we're discussing today. But I really think it's important to have definitive arguments and be polite about it and just explain that, you know, I really, you know, not just your position that you're against it, but we're all pretty much against that. It's the, you know, approaching it with knowledge and facts and a plan. Because obviously if somebody's reaching to doctors, they have something they have to address. And hopefully we can find other avenues to do that. And that's really what's important about, you know, addressing these kind of things.